reform and the labor market outcomes of urban natives in China. Wenjie, how about you give us an introduction of where you are from, and then you start sharing your slides and talk about it. I'll start the counter when you start. So first you should start to share your slides.
Okay. Okay. Thanks for Professor Sinha. So let me share my screen. Professor Singh, can you see my screen?
Yeah.
No, you have to, we don't see it yet.
Are you there, Wenjie?
Sorry. I try again.
Let's try once more. Otherwise, I'll share your slides for you.
Can you see the screen, Professor Sinha?
Yeah, but it's not showing the slide.
You have to have on your screen. Yeah, there's another button you have to click when you're. It's not enough. Like before, we tried it. That.
Sorry.
So do you want me to share your slides if still giving you troubles, Wenjie? Is he there? No.
Sorry, maybe there's something wrong. I tried. I try again. Is that okay now? I have shared my screen.
No, it's
you
not.
You have to click another time on the screen itself. There is somewhere where you have to start sharing.
I'm always being forced to leave the meeting room when, every time I.
Thank you. All right.
I'll share my screen first. Okay, can you see my screen?
Yes, and you can see the time next to my screen as well. So if you go.
Oh yeah, I can see it. Okay, fine. Hello everyone. Good morning, good afternoon, and good evening. Thank you for having me here. Today I will present a joint work with Professor Liu Haoming, titled Minimum Wage and Cross-Community Crime Disparities. This paper appeared on Journal of Population Economics this year. Okay, as we know, crime imposes enormous social costs on the society. And it is observed that there exists pronounced crime disparities across communities, with a concentration on socially and economically disadvantaged communities. And these disadvantaged communities are characterized with a higher concentration of Blacks, higher poverty and jobless rates, a higher share of female headed families, and a lower share of college graduates. However, it is very difficult to disentangle various factors behind the crime disparities. And meanwhile, it is well documented in the literature that minimum wage changes mainly affect the earnings of low-income workers. So a relevant question is, how do minimum wage changes affect crime disparities across communities. Oh, sorry. Sorry. I think I clicked the hyperlink. Wait. Okay. Our study mainly contributes to three strands of literature. The first is the effect of minimum wage changes on inequality. Our study shows that an increase in minimum wage leads to a decline of cross-community violent crime disparities. Secondly, our study contributes to the literature by examining the effect of minimum wage changes on crime disparities and use high-frequency checked level crime data of general population. Last but not the least, our study confirms that economic conditions of low-income workers and locality of environments are key determinants of crime. Our study builds on three main theories of crime. That is Becker's economic theory of crime, Merton's string theory, and Shaw and McKee's social disorganization theory. We compile data from four sources. The first is crime data from police incident data of 18 cities among top 30 cities in the United States. It consists of incidents with description and coordinates. The time span of each city depends on data availability. And we focus on violent crimes, including homicides, robbery, aggregated assault, and rape. And we obtain census-tracked coordinates from the 2010 census. Well, a census tract is a statistical area that generally has a population between 1,200 and 8,000. And we draw census tract characteristics from the American Community Survey, ACS, 5-year estimates for census tracts from 2006 to 2018. In particular, we use the median household income in 2006 to 2010 ACS 5-year estimates to divide the tracts into low and high income tracts. And we focus on, we collect the data of minimum wage adjustments at 4 levels, federal, state, and county, and city and county, 4 levels. But we focus on federal and state levels because the sub-state level minimum wages could be endogenous. We use 2 samples for analysis. The first is the full sample. It consists of 6,778 census tracts from 18 cities in 15 states. We first match each crime to a 2010 census tract, and then we calculate crime rates for each tract in each year quarter by counting the crime counts per 1,000 population. And then we merge minimum wage data with crime rate data. And our baseline sample is a neighboring sample. We retain neighboring low and high income tracts in full sample, and then we obtain this neighboring sample. And in this neighboring sample, it includes 2,161 low-income tracts and 2,097 high-income tracts. Okay, so this table provides the summary statistics of our neighboring sample. Our main variable of interest is the higher of federal and the state minimum wages, which is the average is 8.4. And our main outcome variables is violent crime rates, which is around 2.4 per 1,000 population in a tract in 1 year quarter. Okay, So these two figures presents the distribution of the income across different tracts in the city of Chicago in 2018. And we can see that the tracts are distributed quite unevenly. And the right-hand side presents the neighboring tracts. And we can see that even though these tracts are adjacent to each other, but you can see the income difference is quite stark. A similar pattern can be found for crime rates. And on the right-hand side, you can see that the neighboring tracts, they differ in the violent crimes rate. Okay. We use two empirical models for analysis. In the first model, we express this crime rate in each tract in each year quarter with this minimum wage variable, which is higher of federal and state minimum wages. And then we interact this minimum wage with an indicator of low income tract, which is you can see this is a low INC. And then we also control for tract fixed effect and year quarter fixed effect. The parameter of beta captures $1 increase in minimum wages, the effect of $1 minimum wage increase on crime rate, while the parameter of gamma captures the the effect of $1 increase in minimum wages on the crime disparity between high income and low income tracts. Okay, in the second model, we replace this delta T, this this year quarter fixed effect with CT year quarter fixed effect, that is theta CT. And by controlling for this more flexible fixed effects, the cost is that we can no longer estimate beta because minimum wage is now observed. It is common for all tracts in a city. Okay, the identification of our analysis relies on the common trends assumption. That is, in the absence of the minimum wage changes, crime rate trends across cities, crime rates trend differently across cities, but follow the same trends within a city. Okay. This table presents the baseline results of a study using the neighboring sample. In column 1 presents the results from the using the modeling, estimating the model 1. And we can see that for the high income tracts, there's a little effect, while we can find a significant negative effect for the low income tracts, indicating that low income tracts experienced a greater decline in the violent crime rates following the minimum wage changes. And the same results can be found in column 2, where we control for CT year quarter fixed effect. So $1 increase in minimum wages narrows the crime disparity between low income and high income by 0.161. And if we compare with the previous crime disparity that between low income tracts and high income tracts, we can say that following the $1 increase in the minimum wage, the violent crime disparity between low and high income tracts will decline by 12.1%. Okay, if we look into detailed crime types, we can find that the effect mainly comes from robbery, aggravated assault, and rape. These two figures present the results from event study, and we can see that in the absence of the minimum wage changes, the low income and high income tracts, their crime disparities remains the same over time. However, after the minimum wage changes, the crime disparity between these two types of checks decline immediately. Okay, we explore the heterogeneity of the effect by city characteristics, and we find that the decline in crime disparity is greater in more popular cities, in cities with a lower proportion of people older than 50, in cities, in low-income cities, and in cities with a higher proportion of people receiving food stamps, and in cities with a lower high-income completion rate. We also explore the possible channels through which the minimum wage changes affect crime disparities. And we find that it mainly works from the income channel. And we find an increase in the median household income and multi-vehicle ownership rate, and Gini coefficient declines. Okay, and our results survive a battery of robustness tests. And due to the time constraint, I'll skip this part. Okay, to conclude, our study used crime data from major cities in US, and we find that increasing minimum wages significantly decrease violent crime disparity between low and high income regions. The possible channels is that minimum wage increases the income of low income households and decrease both inter and inter-checked income inequalities. And this finding aligns well with Becker's economic theory of crime and Merton's sociological string theory. Our study have policy implications. So when deciding whether to increase minimum wages and to what extent, government should consider its significant impact on crime, particularly the considerable differences in the effects across communities, crime types, and cities of different types. Okay, thank you very much. Sorry, Kompal, I cannot hear you.
Thank you so much, Lee, for the
yeah.
presentation. Yeah. Any questions for Lee from the room, please?
Sorry, by the way, just now I forgot to introduce myself. I'm Lily from East China Normal University in Shanghai.
Nice. Thank you so much. So if there are no any questions for Lee right now, please put your questions in the chat box as they arise. Can I invite the next presenter? I'm just looking for the time is up, sorry. Oh, okay, the time is up. Thank you. Is Wenjie, are you here?
Yes, Professor Sinha. So I try again to share my screen and to test whether it's okay. Okay, so I'm so sorry. And just now, the computer noticed me that the Zoom app should be updated again. I don't know why.
Sure.
So I try. Can you see the screen, Professor Sinha?
It's the same as before.
Also, there's something wrong. Also,
Right. So I could share the screen. Do you want me to share the screen and then you can talk to the slides and we take it that way, Wenjie? Can you hear me, Wenjie? Okay.
Professor Sinha, could you help me to share my slides?
Yeah, let me do that, and hopefully it should work for us. Can you see the screen now?
Okay, yeah, yes,
Yeah.
I can see.
All right. So let me start the timer and then we can start the presentation. Okay. Do you want to start now, Wenjie?
Okay, okay.
Okay.
Professor
Let's
Singh,
start
can you show the full screen?
full screen.
Yes. Okay, thanks.
Well, Wenjie, also, can you tell the person who's lying on the floor behind you to move out of the picture? We can see
Okay,
him.
okay.
We can see him. Yes.
He's my roommate. Sorry.
Yeah, he should move out of the picture.
Okay, okay. I'm so sorry. Okay. I'm so sorry for that. There's something wrong with my computer, and the Zoom app always notice me that the Zoom app should be uploaded. So I just load something time. I'm so sorry. So let's start. Hello everyone. Good morning and good afternoon and good evening. My name is Wenjie Zhang. I'm from School of Labor and Human Resources, Renmin University of China. So today, first of all, I would like to express my gratitude to the GLO, JOPE, and Professor Zimmerman for the kind invitation. And I think it's my great honor to present our paper published in Journal Population Economics in May 2024. And this paper is co-authored with my advisor, Chuliang Luo, and the associate professor, Xianqian Zhou, and the lecturer, Lu Yuan. So our paper mainly focus on the Hukou, the causality of Hukou reform on the labor market outcomes of urban natives in China. So could you share the next slide? Professor Sinha, I think. The next slide. Okay. Oh, thank you very much. So why we did this research? This idea comes from how significant internal migration is compared to the international migration. The scale of internal migration is much larger globally. And for example, UNDP 2009 as a report estimated about 740 million internal migrants, which is roughly 10.8% of the global migration. And this trend is much more pronounced in developing countries. And let's turn to China. With the reform and opening up policy in China, we have seen a rapid rise in internal migrants. And by 2020, there were about 376 million internal migrants, and which is much more than the total number of the international migrants at that time. So China's internal migration has become an important topic for both researchers and policymakers. Next, could you help me show the next slide? Professor Sinha? Oh, okay, thank you very much. So the research on the migration of natives has been widely discussed in existing literature, but the findings remain mixed. And some studies found positive effects, and others find negative effects. And also the others suggest little or no impacts. So based on these different conclusions, this ongoing debate calls for more empirical investigation. Okay, next slide. Okay, so in this paper, we use the urban household survey data and Hukou reform data, try to identify the causality of the Hukou reform on the employment and income of urban natives. And specifically, we mainly focus two questions. And the first one is, how does the Hukou reform affect an internal migration? And the second one is, how does the Hukou reform impact the labor market outcomes of urban natives? And particularly for we mainly focus on the different responses of urban natives with different skills, which means the skill-based effects. So could you help me share the next slide? Professor Sinha. Okay, thanks very much. So let's review the briefly review the policy background. China's household registration Hukou system was established in 1958, and it categorized residents into agriculture and non-agricultural Hukou, and local and non-local Hukou. One of its key features is to provide better public services for those people who have access to the local urban Hukou. So it has been a major driver of the labor mobility. However, this labor mobility was heavily constrained in the early stage. It wasn't until the 1980s to the 1990s that these restrictions were partially relaxed, but not completely shifted. So starting in around 2001, the local governments were given more autonomy to reform the Hukou policies. And these reforms included the entry-barrier reform and unified Hukou reform. And our study mainly focused on the former one, that is the entry-barrier reform, where the people who meet the certain criteria, such as having the stable income and the legal and fixed residence, could apply for the urban local Hukou. However, existing studies had found these reforms had limited attractiveness to rural migrant workers. Yeah. So our textual analysis of the policy documents reveals that most cities added various constraints such as education, occupation, investment, or home ownership. So it's no surprise that the low-skilled migrant workers had significant limitations under these policies. So by contrast, we can reasonably find that the high-skilled migrant workers are more likely to be affected at the margin. So if more inflows high-skilled migrant workers into the local urban areas, which could create the competition with the high-skilled urban natives. Of course, there's an important assumption, which means that the skills of the two groups are substitutable, or means that these two people are comparable each other. Yeah. So the next slide, could we, yes, okay. As for the identification, we primarily use the two dimensional variations. One is the regional variation, which means that whether the city adopts the Hukou reform, and the other one is the temporal variation, the timing of the reform for each city. So based on these two variations, we used a staggered DID framework to try to identify the causality. So because these reforms are adopted at the prefecture level relative to the urban natives at an individual level, so we can consider these reforms as an exogenous policy shock. Yeah. Okay. Next slide. Okay. Thank you. However, strictly speaking, the adoption of the Hukou reform are not completely random because it can be impacted by baseline characteristics at the city level, such as the GDP per capita, the average wage levels, and the capacity, the physical capacity. So to address this issue, we try to control for these predetermined characteristics at the city level, interacted with the year dummies to try to address with the issue and to make the reform cities and non-reform cities comparable and more comparable. And another issue concerns the reliability of two-way fixed effects estimates, specifically the heterogeneous treatment effects arising from the negative weights. So we tried to use alternative newly DID estimating approach. And finally, we also tried to control for some potentially confounding policy shocks, such as SOE reform and the WTO entry policy, the managed wage policy, the higher education expansion policy. Yeah. Okay. As for the results, we primarily find that Hukou reform indeed attracted the high-skilled migrant workers, and mainly much more pronounced in the younger cohorts, and for both genders, and for the migrant inflows within prefecture and or across prefecture inflows. And when it comes to the employment income effect results, we find that first, we do not find the significant effect of the Hukou reform on the overall employment income, but indeed we find interesting results that we find the employment shift effects, and which is much more pronounced in median and high skilled groups. And a similar pattern we find with the income. Okay. Professor, okay, thank you. As for the heterogeneous analysis results, which are consistent with the results in migration results in the previous section. So we find the employment shift effects for both genders, and the employment shift effects also existing in the younger cohorts, that the 30 to 50 age group, and for both genders. And for the income result, we find the income for the men decreased significantly. However, we find the self-employment income for the women increased significantly, which means that the women may re-enter or shift towards the service sector to increase their income. Okay. Yeah, okay, thank you. So as for the robustness checks, we have conducted several tests to due to the time limits, so I was not go further details. I will skip this section. Okay. Thank you. Professor Sinha. So okay. So additionally, we can also conducted the discussing on the Hukou reform on the larger influx of migrants into the local urban areas, which could also impact the firms' hiring costs, and in turn could affect the demand for the local labor. So to explore this hypothesis, we examine the Hukou reform on the entry of the entrepreneurs or the number of private-owned enterprises. So based on these following three data sets, we specifically estimated the following equations. And our findings show that first, the number of private-owned enterprises or the scale of employment increased significantly, and particularly for the higher demand for the high-skilled workers. And the second one, we find there is a significant increase in the number of employers or entrepreneurs in urban areas in reform cities, compared with non-reform cities. Yeah. Okay. And could you help me? Okay. Thank you. So as for the contributions, first, I think our paper may have 4 key extensions, and so due to the time limits, I would not go further the details. But however, I have to emphasize that our paper have some findings that we focus on the employment shift effects and the skilled bias effects. I think both two findings are the new perspective on in the Hukou reform literature. Yeah. Okay, so to conclude, I will briefly summarize our findings in this paper. Using the 1998 to 2009 UHS data and Hukou reform data, and we use the staggered DID method, try to study the causality of the Hukou reform on the employment and income of urban natives in China. So we find that, so basically, first we do not find a significant effect on the overall employment income of urban natives. However, we find the employment shift effects or the reallocation effects. Moreover, these effects, which are skill biased and particularly much more pronounced in younger cohorts, but with no differences on with gender for both males and females. And men, For the men, they are more likely to transfer to the private service sector jobs, and for the women, they are more tend to shift towards the service sector. Yeah, and further discussion shows that the number of the private enterprises or the self-employed individuals are increased significantly, and particularly for the high-skilled, the demand for the high-skilled workers. Yeah, that's all my presentation. Okay, that's all my presentation. Any comments and suggestions are welcome. Okay, thank you very much.
Thank you so much, Wenjie. Any questions for Wenjie, please? Thank you so much. I really appreciate your presentation there, and it's a very, very nice piece of work. It's good to see how many robustness checks you've done, and just goes to show how intensive some of the papers become at the end. Let's move to the next paper now, and we've got Saravana Ravindran here with us, and he's going to talk about disruptions to early childhood preschool services during a pandemic, evidence from India, and this paper is co-authored with Manisha Shah. Please start with your introduction, Saravana, and then we can move on to presentation. I'll put on the timer.
Great, thank you. Thank you so much, Klaus, Kompal, and the organizers for putting this together. I think it's a great opportunity to share our work. So I'm Saravana. I'm at the National University of Singapore. I'm at the Public Policy School. And this is joint work with Manisha. She's now at UC Berkeley. So today I want to share our work on disruptions to early childhood preschool services during a pandemic. And this is drawing on evidence from India. Okay, great. So I want to start by noting that, a large body of work now documents adverse effects of negative shocks during early childhood years on later life human capital outcomes. And so investments during these critical early childhood years are really important to improve the lives of low-income families around the world. However, the COVID-19 pandemic disrupted the provision of these early childhood preschool services in many countries. And so our first research question here is really to understand these service disruptions. So what is the extent to which the COVID-19 pandemic really disrupted the provision of early childhood preschool services? And we're going to look at this in the setting of a developing country and that of India, which has the world's largest early childhood program. In addition, we think that really understanding factors that could mediate the provision of public services during crises and pandemics is of real primary policy interest. And here we want to focus on the roles of worker locus of control, so how much agency they have over their work as opposed to external forces, as well as the role of public service motivation. And so this is the second key question of our study. We really want to understand the roles played by worker locus of control and public service motivation in mediating the provision of public services during these times of crisis. So in the interest of time, I won't go through an extensive literature review, but I just want to highlight that in what we're going to do, we are going to take advantage of not just federal, but also state government lockdown policies that really zoned these areas into different intensity of lockdown measures. So I'll talk about these red, orange, green zones that were in place in India during the pandemic. So we're really going to take advantage of this, which is a contribution to some of the previous work that has, for example, taken advantage of, say, a higher level federal government lockdown measures. So that's the first. And second, by putting this together with data that we collected that can really look at different points in time through these surveys with workers, we can leverage both the spatial as well as the temporal variation to use a quasi-experimental study to really get at disruptions of preschool services in a low and middle income country setting. And so that's a unique contribution to the literature. And then third is this understanding of worker locus of control and public service motivation as factors mediating public service provision during the COVID pandemic. That's a third contribution to the literature. So having said that, I want to jump to the context of our study. So the Integrated Child Development Services, this is the flagship program in India that provides free primary healthcare services and preschool education to children under 6 years of age. So this is the world's largest early childhood program. And the reason it's called integrated is because it has these integrated components of health as well as education. So health components include height and weight monitoring, provision of vaccinations in normal sort of non-COVID times, distribution of take-home rations, home visits by the workers, and so on. And then there's the education component, which are preschool activities for children in the relevant age range. So about 3 to 6 years old, they provide preschool activities for children. So within India, we're going to focus our study on the state of Odisha. Now, why Odisha? Odisha really saw the largest percentage increase in beneficiaries of preschool services between 2014 and 2019 across all states in India. Okay, so this is in comparison to a 19% decrease across India over the same time period. And so this is why we focus on Orissa, but having focused on the state, it's not like the program is very unique and different. It operates in a similar manner to the rest of the country. Centers often run for about 3 to 4 hours per day, and then the workers do home visits for about an hour per day. And these centers are primarily managed by one worker, sometimes with the help of a helper, but these are typically one-person operations. So that's ICDS. Now, what happened during the pandemic was that ICDS workers, like many other frontline workers across the world, were tasked to do various COVID-19 activities. And these include a whole range of things ranging from community surveillance to identify suspect COVID-19 cases, distributing masks, monitoring protocols, providing information, so on and so forth. So they were tasked with a whole range of other COVID-19 activities. As a result, we anecdotally understand that these preschool services were disrupted. In-person delivery of preschool education was disrupted because ICDS centers were closed. And even though the workers tried to still provide these services to parents, sometimes they digitize educational activities that are typically conducted in the centers to share with parents. We know that there were severe disruptions to the preschool services, and we really want to understand the extent of these disruptions. So the data that we collected is the following. So we start with our sample frame is the universe of all more than 10,000 ICDS workers in 3 study districts in Orissa. So how do we choose these districts? We wanted to be careful. And so we chose 1 district from each of the 3 administrative revenue divisions in the state. So we are working in the districts of Baleshwar, Denkanal, and Ganjam. These are the 3 study districts. And at the time of the study, we worked with the Department for Women and Child Development, and they gave us this list of more than 10,000 ICDS workers. We've done now primarily 2 rounds of data collection with additional focus group discussions in July of 2021. But the 2 main rounds that we're going to be using data collected from April 2018, and then a second round that was during COVID, that's from December 2020 to about April of 2021. So we have a nice sort of pre-COVID baseline that we can use, as well as data that's collected during the COVID pandemic. And then we went and followed up with some of these workers to look at, conduct some focus group discussions. So in our second rounds of surveys, we had completed surveys with more than 5,000 of these workers, some of whom had been surveyed in 2018. And then we also drew on the pool of workers who had not been surveyed earlier to make sure we had a large enough sample. Okay, so we're asking workers about various things, including lockdowns. And so that's what I want to start with first. India imposed a nationwide lockdown to contain the spread of COVID in March of 2020. In April 2020, all districts in India were divided into red, orange, and green zones. And these already indicate to you the severity of the lockdown measures. And this was based on the severity of the COVID-19 outbreak in these districts. And subsequently, this identification strategy has been used in the literature, including I have other work with Manisha that looks at the impact of this on violence against women, for example. This is also published work. And so that's at the central government level. These are district classifications that have been done. What happened in June is that these lockdowns then became under the jurisdiction of the state government. So the central government said, okay, state governments are free to decide within their states the intensity of the lockdown measures in the various areas. And so what we did in our surveys is that we asked workers to tell us about the restrictions in their very local, fine geographic area at 3 points in time, which are equally spaced apart. So these in May, August, and November of 2020. So we're going and doing these surveys and asking them, okay, can you tell us about the restrictions in your area in May 2020, August 2020, and November 2020? And so this final level of variation is the key source of variation that we're going to use in this study. So there are the district level initial central government district level classifications, but we're going to use a much finer within state variation as reported by workers. And so just to check that what the workers are reporting in terms of the lockdown measures also makes sense, this is just a plot of workers reporting what was allowed in their immediate geographic area in terms of public transportation, offices, movement across districts, and operations of these ICDS centers. And so what seems to be the case is that in almost all of these graphs, it's clear that this is kind of monotonic pattern where the red districts are the ones that are, or the red areas, I should say, are the ones that are having these very severe measures, followed by the orange and followed by the green. So it sort of lines up with how the policies were intended. Okay, so then I want to move on to just descriptive results. I think just plotting this already gives you a sense of the data very clearly, even before we go into the empirical strategy. So when we're asking the workers about the provision of these preschool activities, pre-COVID, everyone was providing these preschool activities, but then you see large drops in the provision, especially in May of 2020, when a lot of these lockdown measures were very acute. So that's where, especially for the red zone districts, you see very large falls. There's some, it sort of goes back to closer to pre-COVID levels in August and November, but doesn't quite reach the full provision of preschool activities. This also we see very clearly in the data when we are asking about their labor supply and the time allocation across these preschool activities, other ICDS-related activities, and as well as other non-ICDS or even these COVID-related activities that they're being pulled into. So the empirical strategy follows a very standard difference in differences. We're going to have a setup where we are regressing the outcome variable of interest on sector and quarter fixed effects. So sector is a geographic area within which the centers are located, and then the quarter is these different month quarters in which we're asking these workers. And so we're doing these comparisons between the red versus the base green zones, as well as comparisons between the orange zones and the base green zones, controlling for other age and years of experience of these workers, clustering our standard errors by sector and quarter. Okay, so I mean, these regression results really paint a picture of what we saw in the graphs. I think the graphs tell a very nice visual representation, but we see about a 23 percentage point decline in the provision of preschool activities when it's in these red zone areas in May 2020 in comparison to the green zone areas. So that's where it's most acute. This we see in terms of the hours worked in preschool activities, in the other ICDS related activities, and they're spending more time on these COVID activities. And that's consistent with anecdotally what they are being asked to do in these areas and during this time. So having established that, what we want to do then is try and understand what are some of these mediating factors. Then we focus on locus of control and public service motivation. So why public service motivation? Why does it matter? So India's ICDS, like programs in many developing countries, it's limited in the scope to motivate workers through very sort of high-powered monetary incentives. wages for these workers are low, and despite demands from workers and unions to increase wages, these workers are paid low wages, and so there's little scope to do it through very sort of high-powered monetary incentives. We also think that some of these public service motivation could be important in thinking about mediating some of the other mental health impacts that we've seen come through COVID. And we think that this is also important when we think about, okay, what are innovative ways through which these workers can deliver these services? And there are documented cases of this in the state of Orissa as well. And so this is why, these are some reasons why we think focusing on these dimensions could be very important. And when we interact that, what we see is that workers who have a high locus of control, a high sort of agency over how much control they have in their work, they are about 6 percentage points more likely to provide these preschool services relative to their comparison groups. And workers with high public service motivation are about 8.5 percentage points more likely to provide preschool services. So what we're seeing is that there is big declines in the provision of preschool services, but for workers who have high locus of control and high public service motivation, the decline is smaller. So these factors are stemming the declines by about 27 to about 37%. And that we see very clearly come out in the hours spent on preschool activities as well. Okay, so just to discuss and conclude.
Saravana, can you please wrap up a minute or so?
Yeah, this is the last slide. So in terms of we find in terms of our focus group discussions very interesting insights for why this might be the case in terms of it's hard for workers to provide these in the homes of individuals, and so we document that. But it also leaves us with some thoughts for policy going forward in the role of public service motivation, thinking about hiring and retaining workers. I think these have important policy implications. Okay, thank you so much. I'll stop there.
Thank you so much, Saravana. Any questions for Saravana at all? All right, I'll take the opportunity. Thank you for your presentation and the findings there. Can we move to the next presenter now? And we have Gitanjali Sen. This is co-authored work with Banerjee, and the topic is Persistence Effects of Conditional Caste Transfer, a case of empowering women through Kanyashree in India. I'll hand it over to you, Gitanjali, if you want to start sharing your slides, please.
Yes, one thing, I mean, my computer has stopped Zoom, so I'm just trying to share from my phone. Just give me a few seconds. I think I should be able to. Or in the interest of time, is it possible for you to share my slide that I had sent you? I'm just trying. I don't want to lose much time in this. Yeah, I can say it. Yes.
Okay, so I'll start the timer and then you can tell me when to roll the slides.
Are you all okay? Like, because I have my other screen, I can keep on talking. If others can see my slide, I'm okay. I can. Okay, so let me start. Yeah, so it's like 15 minutes. I'm counting because I can't see your screen. It's from the phone and my other screen is off. Fine. Thank you so much for being here. Good morning, good afternoon, and good evening, all of you. So this paper is co-authored with my PhD student, Shubarna, who couldn't present here today. So she's a 4th year PhD student in the job market now. So Kompal, can you go to the second slide?
Yeah.
Let's see the Zoom screen. Okay, So this is about a gender-targeted cash transfer program, which are found to help in empowering women and financial autonomy. There are several such programs all across the world. But most of the studies that look at the impact of cash transfer program on women that look at the immediate effects, and there are much limited evidence when you think about the long run empowerment outcomes. And literature is also found a lot in Latin American countries and South Asian context, because there are a lot more such programs available in the context of those countries, whereas much less available
So I hate to interrupt. Sorry, but at the moment we see nothing. We see just a man standing somewhere with sunglasses.
Sorry. I'm so bad.
We do not see, now you see me. We see me.
Oh,
But because I'm talking.
I'm so sorry. My screen has gone. Let me just. So my slides are not there. Then I believe slides are not up there.
No, your slides are not here. But I thought Kompal would
Let
give
me.
the slides.
Yeah, I was trying to do it, but it seems it's not showing, right?
Now we see you.
Let
Now
me.
the slides are back.
Yeah. Okay.
Now we see you, Kompal, and the slides.
All right.
Okay, so slides are available, right?
Yeah.
Yes. Also now we have
Others.
you as a voice, but and see the slides. That's acceptable so far. If you go on, can you see the presentation?
Gitanjali, can you see the presentation? This is just from the first slide right now. Are you there? Hello? I think she's dropped out. Do you want to pause the recording, Klaus?
What?
Do you want to pause the recording? I think she's.
Oh, yeah. I do this. Okay, sorry.
PhD student Subarna Banerjee. And so this is about a cash transfer program targeted for the girls between 13 to 18-year-old age in West Bengal, India. Coming to this cash transfer program, which are particularly targeted towards women for increasing their financial autonomy and human capital. There are some of these programs are largely available in the Latin American and African countries, and where the literature is more available in terms of measuring the immediate term impact, short-term impacts, or the impact when these women are receiving the benefits, whereas literature is more scant in if you think about when they graduate out of the program, or what would be the long-term effects of program. And coming back to the context of Asia, South Asia particularly, there are less such programs available which could target not only their education and human capital development, but also the financial autonomy or empowerment, women's empowerment outcome. So in that context, this particular program, Kanyashree, which was launched in 2013 in the state of West Bengal, India. Here, the cultural norm is a bit different, because the girls, like here, mostly the marriages happens as a arranged marriage setting where girls do not have much of a choice in their partner in general, and also the cohabitation or pregnancy outside marriage is not very common norm. So in such settings, actually, the cash transfer program, which could be targeted to girls, and girls could be the beneficiaries, and what would be the outcome if it could empower them in future, those are more interesting research questions. Policies targeting such inequalities, actually, they, as I said, they lack long-term evidence. So in this paper, we also try to look at the impact on how it helps in empowering women once they stop receiving this kind of potential transfers. Next slide, please. So, as I said, this is launched in West Bengal in 2013. So what is the program? A girl of the age between 13 to 18 years old is eligible to receive certain transfers from the government if they are enrolled in school and if they remain unmarried. So if they remain unmarried and enrolled in some educational institutions, then for each year, there was one component that they should receive each year, rupees 1,000 Indian rupees. When they complete, if they keep staying enrolled in school and they remain unmarried, then after attaining 18 years of age, they receive a lump sum amount, which is 25,000 Indian rupees. So, the other two important things about this particular program is this money is directly deposited to their bank account, which they have a zero balance savings account, and schools help them to do all these things. So what school does is, if you are enrolled in a school, so schools would send those forms on your behalf to the government, and schools will be the intermediary in helping you to open your bank account. That's one thing which makes things very easy, and that's why the rollout has been much easier, because they don't have to initiate anything on their own. And the second thing is, it doesn't make anyone ineligible in terms of, you are not in an age relevant grade, or you have to show a certain certificate or nothing like that. If you are enrolled in school and if you are unmarried, you would be enrolled in this program and you can receive benefit. So what we do in this paper, we aim to look at the persistent effects of the program on women's mobility and their perception towards domestic violence. So there are some of the next slide, please. So we use the National Family Health Survey data, 3 rounds of the data that we use, and which is a DHS data. That data has a question about certain questions about women's mobility, like the women are asked, like, if you have to go out of your house to the market or to the community to meet someone, or to go some health center, do you have to take permission from someone? So each of these questions are asked separately. Those are the mobility questions that we use as separate outcomes in our analysis. Also, for the NFHS also asked questions about their perceptions towards domestic violence. So, do you think it is beating by your husband is justified when you burn the food, or you refuse for sex, or you neglect your children? So there are several such questions are asked. So we also look at the women, the outcomes, those outcomes. What is these women's perception about this kind of outcomes of domestic violence? So why we keep the sample to 15 to 35? Because these questions are asked at the lowest age that the women are in the sample, but these questions are asked is 15. So our framework is pretty simple. Difference in difference. First, there are two different methodologies we use. One is with difference in difference. So there we use basically time-based. So one cohort is the eligible cohort who could be eligible based on when the program was launched and what is their birth year. So if you are older than your eligibility, so you could not receive the program, and the younger cohort could receive the program. And we also have different rounds of NFHS data. So we use pre-round and post-round. So it is that difference in difference, younger cohort and older cohort, and pre and post-round of KP. So, but obviously it's a time-based difference in difference methodology, which could be questioned, because if there were any other simultaneous programs or something which could be time variant and could have affected the outcomes in a similar way. So in order to check that, we also use a triple difference methodology where we use the neighboring states and we show all the parallel trends, whatever assumptions are. So those are like, we don't find any evidence of, being a trend for both the double difference or triple difference methodology. So these are the methodology we followed, but for robustness check, we also do propensity score matching for DID and triple D, both the methods. And we also use inverse probability weight matching in our study. So what we find is, the beneficiaries have a 7 to 8 percentage points higher likelihood to travel alone to the market or health facilities or outside their village. For these mobility outcomes. For the domestic violence outcomes, perceptions to domestic violence outcomes, we find that there are 4 to 5 percentage points lower likelihood of justifying this violence. And we find that the program effects are persistent even after you stop receiving the benefit. So when they stop being eligible, even if I look at that cohort that who were supposed to be exposed earlier, we still find the program effects. We do some dose response analysis where we look at the years of exposure, and we find that higher the years of exposure, you have a higher evidence of effect. We also calculate the amount you are supposed to receive, because the amount varies based on how many years you have been exposed, or if you have graduated 18 years of age when we have received the lump sum amount. And we find that with that respect to that dose also you have higher effects. So mechanisms, when we check, we found that the increased years of education being one mechanism, and also having to access to bank account being the other. So how we checked it, we run separate estimation with these two being dependent variables and your treatment. We run those on treatment, and we found the higher effects of treatment on these dependent variables. We also look at the mobility outcomes, and then we run those regressions on these variables, increased years of education and financial independence, and we find that these have higher effects on mobility outcomes directly as well. So finally, to conclude, we find these long-run effects, persistent effects of this kind of CCC on empowering women, and we find that our methodology is robust, not only with respect to different estimation strategy, we also change the age band, and we also look at randomize the treatment and run 1,000 simulations of those randomized treatment, and we don't find any effect for those 1,000 simulation where we randomly assign treatment. And we highlight that pathways are through education and financial empowerment. Finally, this has a policy implications, and it has a way of integrating financial literacy, because the money is directly transferred to the bank account. Also, if the quality of education could be targeted to improve along with an access with quality, could help empowering women in the long run. Thank you very much.
Thank you, Gitanjali. Any questions for Gitanjali at all? Right. That's good. So thank you so much. And we can now move to the next presentation, which is by Queen Quang. Hong?
Okay, I'm here. You can call me Qianqian.
Okay.
So I will share the screen.
Yeah, start sharing the screen. The topic she's going to talk about is the impact of global warming on obesity. And
Okay.
again, this is authored work. I'll hand over to you now.
So can you see the screen?
Yeah.
Okay. Well, hello everyone. It's really an honor to be invited to share our research here. This study is about the impact of global warming on obesity. Oh, sorry. Let me open the camera. And this research was done by Professor Kanyashree and me. I'll present our research from the following aspects. Obesity represents one of the most significant challenges in modern society. The global obesity rate has nearly tripled since 1975, and obesity is also a major cause of disability and is correlated with various diseases and conditions. And global warming is expected to have a substantial impact on human obesity. However, based on existing studies, we are still unable to answer two important questions. First, what is the overall impact of global warming on obesity? Second, to what extent could adaptation help reduce the impact of global warming on obesity? About the data, our primary analysis used the data from 1975 to 2016 from 152 countries. These countries collectively represented 99.1% of the world's population. The outcome variable is the adult obesity rate, defined as the percentage of adults with a body mass index equal to or greater than 30. The key climate variable utilized in this study is the annual mean temperature, and 5 other climate variables are as control variables like annual total precipitation, wet day frequency, so on and so on. Also, we have climate change projections and other variables. About the causal effect identification, we compare a country to itself in years when it is exposed to warmer or cooler than average temperatures due to natural occurring domestic atmospheric changes. So we depend on the following fixed effect panel model to estimate the causal effect of warming. The YIT represents the adult obesity rate for country I in year T, and this one represents the J-degree polynomial of annual mean temperature. So we can calculate the marginal effect as equation 2. We also investigate the extent to which the effect of warming on obesity varies across countries with different incomes, where income IT represents log GDP per capita, and all other variables are the same as previously. Similarly, we can calculate the marginal effect as equation 4, where income bar represents the average income of country I over the same period. As individuals have sufficient time to adapt to long-term temperature change, so we extend the baseline model to the following long difference model. The main difference from model 3 is that here the temperature measure is the average temperature over the preceding 30 years to up to year T. We then infer the effect of adaptation by comparing estimates from the two models, like equation 6. So let's see the results. The baseline estimates indicate that the warming has a significant positive impact on the adult obesity rate when the annual temperature is below 27 centigrades. But this effect turns negative when the temperature exceeds that threshold. The marginal effect of 1 centidegree increases in temperature on obesity ranged from 0.56 to 1.87% across different countries. This figure represents the marginal effect of warming on obesity across the distribution of country level log GDP per capita, adult average age, and adult average years of schooling. Let's see the mechanisms of the impact. Global warming can influence the calorie intake by altering the income, consumption preference, and food prices. Also, the global warming may impact calorie expenditure by changing the working time hours, minimum calorie requirements, and physical activity levels. So we employed the minimum calorie demand, physical exercise index, per capita calorie intake, and the per capita fat intake as the dependent variables. So the figure 5 shows the results. This figure represents the response function and marginal effects estimated based on the long-term models using the third-degree temperature polynomial as the primary explanatory variables. Finally, we combine the estimated marginal effects with the projected warming from 2016 to 2050 using the intermediate emission scenario to predict the impact of global warming on obesity. To conclude, the estimates suggest that global warming significantly increased obesity in most countries, with the exception of a small number of tropical countries. We estimate that a 1 centidegree rise in annual mean temperature would increase the number of obese adults worldwide by 12.3%. Moreover, we identify substantial heterogeneity in the impact across countries in various regions and with differing income levels, age structures, and education levels. Finally, our findings indicate that long-term adaptation may not significantly mitigate the impact of global warming on obesity in temperature zones. So that's the presentation. Thank you again.
Thank you very much. Thank you. Any questions for the speaker here? No? All right. That's good. So we finished quite early, so thank you for that. You covered up for all the time that we started earlier. So now we're on to the next presentation, and we have Ranjodh Singh here talking about cannabis and tobacco in substitutes and complements, and this is co-authored work as well. Can you please start sharing the slides? Yes, thank you. All right, over to you now. Can you hear me, Ranjodh? Yeah, we can't hear you though.
Of course, it has of course, it has a cost and benefits associated with it. So, and we're not really going into the nitty-gritty of the costs and benefits. What we're going to focus on is just consumption behavior. So one of the challenges with all this is this idea of decriminalization or legislation. Those two terms are often confused, but they are actually two different things. So for the moment, we're going to focus on this idea of decriminalization, which basically means that, you know, the criminal charges for possessing the drug are dropped, but you can still have civil charges. And if you have small amounts, you know, the penalties are reasonably small, but it's not still considered legal, whereas legalization is something else altogether. So those are the challenges that we have with these drugs. So something to keep, you know, to keep the motivation there. Many times in Australian media, you see these headlines. I've just sort of collected a few of them for our benefit, just to sort of show that it is on the Australian conscience of what we're supposed to do with this drug. And the most recent one, which was posted just a couple of days ago, the 3rd of December, they're pretty much asking for decriminalization of cannabis as well as other drugs. And this is from basically the peak body of medical doctors. So that's, you know, this is the reason why studying something like this could be quite beneficial, because it's of, you know, some importance to society. So really what's happening is that we are focused on what's known as consuming in sort of bundles. So in other words, you know, most of the time when drugs are consumed, namely say cannabis or tobacco, they're consumed jointly. And, you know, there are some street names, you know, such as blunts, mulling, or chasers. I'm not going to explain what these are. These are sort of street ideas of how to combine two drugs. Maybe, you know, people like to kind of mix their cannabis with some tobacco and then smoke it. You know, that's one way of doing it, but there are several others. But the economics of it is interesting, because what would happen if you sort of focused on, you know, changing or somehow legally restricting or doing something to one drug, what would be the implications on the other? And quite often, you know, people don't think about that, or policymakers are seldom thinking about this, and it has what's known as unintended consequences. And so the framework we want to put this into is something like this. So the economic framework is, well, you know, are they substitutes? Are those two substitutes, or are they complements, right? So, and here we're focusing on cannabis and tobacco, although the paper talks about cannabis and alcohol as well. But, you know, typical, because we didn't really have a strong result there, so that result's not really spoken about, but that is also mentioned in the paper. So substitutes, in other words, you know, as the price of one good goes up, the quantity demanded for the other good also goes up, right? So that's this idea of positive cross elasticity versus the complements. And basically where our sort of paper comes in is that the literature is kind of not set on this. You know, there's one side of the literature that says that, you know, cannabis and tobacco are complements, another side that says it's a substitute, and then there's also a kind of a study that shows that no, they're actually independent, you know, nothing to do with each other. So, well, which one is it, right? So that's the conundrum. We need to figure out what's going on. And so, you know, some of the reasons why, you know, you could say, oh, there are differences in the economics of consumption around these two goods is probably due to data or estimation processes. And people have looked at that, whether it be, you know, the lack of data or the type of estimation process that's used or not being addressed appropriately. That could be one reason. But we'd like to think of another reason, and that is, you know, maybe these economic relationships are actually changing. And what we mean by that is that, you know, over a life cycle or over an entire age spectrum, the relationship might change from being a complement to a substitute or vice versa. So this is something that, you know, the literature has talked about, but hasn't put together, you know, in the way that we're trying to do. So of course, there's going to be differences between the decision making of, you know, taking drugs between the younger and older populations, and that's due to these ideas of risk aversion, how they do their discounting, and basically there's some elements of the rational decision theory also apply. Not everything, but some of it. And then, so overall, what we're trying to do here is sort of contribute, if the relationship between cannabis and tobacco changes across the age spectrum using survey data from Australia and a whole lot of specifications. So what we plan to do is basically, the results, sort of a preview, is that the whole life cycle idea does make sense. And what we're going to find, what we're going to see, is when we fit reasonably straightforward models, what we see is that the two drugs are complements for younger age groups, and they are substitutes for older age groups. And there's a sweet spot in the middle where they appear to be fairly independent, i.e. there's no relationship. So this is pretty exciting simply because it kind of marries up with what the literature has found. But unfortunately, the literature was only looking at one population segment at a time. Here, once you look at the entire segment, what you find is you can explain all the behaviors, right? So that's the exciting bit about this. So a little bit about the data. We're pretty much using data that has been used by other researchers. Our dependent variable is, basically whether you've consumed cannabis over the last 12 months. We also have frequency of use, and we do use it as well, but really we just need the participation. That's all enough for us. And then the other interesting thing is we also have this idea of the level of decriminalization for each state. So in other words, what is the state's attitude towards cannabis possession? Do they give you a warning? Do they let you off? Or is it, every time you're found, they write up the criminal charges or the civil charges? So we sort of use that. And then we've got an extensive list of controls as well to kind of look at this. So what we're finding, and then of course, the other main attribute here is that we have really good sort of data, cannabis price data from this very famous drug reporting system, which basically we use to standardize prices. And we do this by state, amount, quality, and also interactions between state and quality. Tobacco prices, as well as alcohol prices, we get from the standard ABS, and these are CPI adjusted as well. So our sample, what it looks like, we have about 98,000 observations, aged between 16 and 65, 13% overall cannabis, et cetera, et cetera. So, we try to keep our sample representation reasonable. And then you can sort of see participation rates, whether someone has used cannabis over the last 12 months, what do they look like over the years? So most of the time it's kind of hovering around the 13%. You can see why it's 13% overall. Males and females, males slightly dominating, and then of course across all of the Australian states as well. So with WA being possibly the leader. And then by age, you sort of see the people that participated peaks around 18 to 25, and then starts to gradually drop as time goes on, right? As your age goes on. So our specification is reasonably simple. We have a sort of a pooled probit model to kind of model this, and what we're trying to do in terms of to understand this idea about how age plays a part, we let age kind of take a linear relationship. We have age dummies, which is our most flexible relationship. We have an interaction term, and then we also have quadratic term, right? So, overall our results are, fairly as expected, males having higher participation rates, English speakers having lower education, et cetera, et cetera. Nothing weird about this. This is just a snapshot of the estimate. I don't want to really share this, but just provide evidence that, we did get estimates, so we could draw these nice diagrams. So it's really, it's in the power of the diagrams. What you see in the diagrams here is basically, the squiggly line is the most flexible framework, right? So that is, if you use age dummies, that's what you're going to get. But then if you fit it with a linear, which is given by that light green line, and the blue, which is the quadratic one, you can understand that quadratic is probably the best one there. So we use the quadratic specification kind of move as our best model. And then if you put sort of confidence intervals around it, then what you see is this idea of a complementary effect, no effect, and a substitution effect. You kind of sort of see it around the, under 40, between 40 and say 55, and then, over 55, you have the substitute effect. So that's a nice result because it helps explain what we see in the literature, but it gives us that one kind of picture rather than, where researchers have in the past claimed that they can only see complementary effects or they can only see substitution effects. Now we can understand why they were seeing these things. This is a snapshot of what our model versus the actual data looks like. So the actual data is given by the red line, and you can see, that's the actual participation rate across the age spectrum. And the blue line is our model with the dotted lines, the confidence intervals. And you can see it's a fairly okay fit. Then what we do is we use the model to, fit a 3D kind of outlook, but this time we involve price and age. And what we see is, that relationship, when the price is cheaper, participation amongst the younger people increases, but when the price is more expensive, it gets dearer, than the participation rate amongst the older cohorts gets lifted. This is just snapshot profiles. If you can't see that in the 3D graph, then for particular age groups, you can sort of see what's happening. So for the red represents a typical 25-year-old, very responsive to price, and very quickly the participation rate will drop, whereas someone who's 45 really doesn't change all that much, and then a slight increase if you are 55, right? So you sort of see that increase as you go along. Well, what do we do with all this model? Well, one of the nice things we want to do with modeling is use it for something useful, like policy. So typically in Australia, policy for tobacco prices, is heavily influenced by excise prices. And what we want to do is basically look at where Australia sits in terms of its excise price. It's fairly high, but there are countries that are higher, like France, Finland, and New Zealand. They definitely have higher prices, higher excise prices. So, we want to kind of use this relationship of, use the excise levels as a lever to see what the effect is on tobacco price. And we're doing this so that if we lift tobacco price, then what is the effect on cannabis consumption, right? And this is just a quick and dirty analysis where it shows the relationship between excise and retail price. It provides us with the justification that most of the excise is going to be passed on to price, right, to the price itself. So basically what we do in our scenario analysis is we have potential excise increases of 10, 5, 10, 15, etc. increases. And then we assume that all of this excise is passed on to consumers. And then we sort of see what the impact is on cannabis consumption. And this is what we get. If you, on the horizontal axis, you have the excise increases. And as they get higher and higher, you see the change in probability or change in participation. The nice novel thing about this is that we've also used the Krinsky-Robb method here to kind of put bands around our estimates. So as excise increases, the uncertainty around the parameter, we can also sort of put that in there. And then we want to translate this to actual population data. So what you see here is a 5% increase, will indicate a drop of, 170,000 or 175,000 people aged between 16 and 39, and, maybe 8,000 drop. And then, but for 51 to 65, there'll be an increase by 31,000, right? And of course, the net will still be a decrease because the net effect of price increases is still a decrease. But the nice thing is that you can see for which age groups it's going to be responsive. They're going to decrease their consumption, but this age group here is going to increase its consumption. So you see this all the way along. And so this is primarily telling us that, if we were to come up with a policy, we really need to think about its targeting. Who will it target? And understanding this sort of behavior helps us target things better, right? So that's pretty much it for me. Thank you.
Thank you so much. Thank you so much. Interesting piece of work to finish our whole session here. We still have some time for any questions that you might have for the last presentation, for any of the presentations that you saw. Are
Kompal,
there any questions?
before we go ahead, can the speaker again present his first slide with the title and repeat the nice sentences he had about his parents and the media, because we would like to have it for sure on the presentation.
Okay, not a problem. Yeah, so thanks to the recent publication of this paper, it was picked up by the media, and who have contacted us and asked for more comments on this issue, and I'm dreading to appear in front of the TV to talk about this, because I love the econometrics, but the topic itself is rather sensitive, so that's why I sort of think that my parents will question my research choices, but I have to be very careful how I tread here. But it's exciting news. I think people are interested, and that's why I had those newspaper articles, because it is on people's kind of collective conscience. People are thinking about this. There's a lobby group in Australia who's been active on this for many years, and our job as economists is really to kind of get to the heart of the matter, and so that we can let policymakers provide them with enough evidence to make good policies. So yeah.
Thank you very much. So even I got it now. Thanks.
Not a problem. I'm sorry about the start, because I had no idea why the sound wasn't working. But anyway, I managed to get it happening.
So what is the policy? What are these media outlets interested to know then? What has been the most interesting question you received from them?
Well, I didn't know about this because this article that I have on the slide at the moment, the 3rd of December 2024. So this came out, and then someone put this together with what we had just said, and this came to us and said, "Oh, we'd like to talk to you about this." And these are like your normal news people. So I should say, this was also part of a conversation article. I mean, those who are in Australia know a lot about conversation. In fact, even internationals would have heard about it. But conversation is a very popular piece in Australia. So we're writing a conversation piece at the moment, and maybe that's where the leak was. And so next thing we know is, what does this mean? I mean, if I were to talk to the media about this, I would tell them that decriminalization, based on what we see, decriminalization does not affect consumption, right? So if you decriminalize something, that's not going to increase or decrease your consumption. That much we can say. And by the way, we're not the only ones that are saying this. Previous research has also found this, but with this bigger evidence base, it's the same thing. Legalization, on the other hand, that's a whole different story. That I don't know much about at all. But decriminalization, definitely we can say it doesn't move a needle when it comes to consumption. So that's probably going to be my message, and that is in support of what the peak medical bodies asking for. Is let's not really heavily penalize people who use small amounts for most likely medicine or therapeutic effects. Yeah.
Thank you. Very nice. Wonderful session we've had today. There were some technical issues, but everybody got to do their full presentation. I hope everybody's happy with themselves. I am. So thank you so much. And I appreciate your taking the time to be a part of this session. Please connect again after this small break that we have. And there's some very nice papers being discussed today and tomorrow. Klaus, did you want to say anything before we all sign off?
Not really. I'm happy too. And these issues we have, these technical, and we solve them. Thank you very much for joining us, and hope to see you in other sessions today or tomorrow. Thanks.
Thank you so much. Thank you so much, everyone. You have